Hello, everybody, and welcome. My name is Oliver Zorno, and I'm a board member of First 5 Fox Valley, and I'm pleased to be asked to host this webinar. I'd like to welcome you here as we talk about thriving communities. In my day job, I'm the executive director of the Building for Kids Children's Museum in Appleton. We're a regional children's museum, and we partner with so many early childhood projects throughout the Fox Valley region. A few notes about the webinar mode of Zoom. All of you participants are muted without video or sound. You can add comments in the chat, but the best place for questions for our panelists will be in the Q&A section located at the bottom of your screen. It can be for one panelist or for all of them or somebody you don't know. But if you have a question, please put it in that Q&A and I'll be monitoring those throughout the webinar. We will have some time at the end to respond to those questions and thoughts you might like to share. There'll be an opportunity for that as well. So a little bit of background on First 5 Fox Valley. It's a nonprofit backbone organization that has a mission to cultivate a community that empowers and supports every family to build a solid foundation for children in their first 5 years. We work collectively and collaboratively with our community partners in early childhood programs to make sure young children get what it takes to thrive and support their readiness for school. Now, the reason that we have gotten together today is because of this ongoing COVID-19 pandemic has taken a toll on our communities, businesses, families, and our children. The state and federal governments are investing in local communities to help deal with these losses, but many of these funding streams are complicated and have guidelines and expectations that seem somewhat difficult to unravel. We know that as community leaders are making decisions on how to allocate these funds, it is helpful to have accurate information and a place to ask questions from a local perspective. With that in mind, we have connected with several national groups to provide guidance on how to use ARPA funds in local communities, counties, and cities to leverage these dollars in critical ways. I want to introduce quickly our panel of presenters before they get started. First, we have Barb Tegenstahl. She's the executive director of First 5 Fox Valley and a state lead for the Help Me Grow Wisconsin affiliate. She'll be presenting a picture with local data about the impacts of COVID on children's development, stress placed on women from COVID, and how childcare industry locally was and is being affected by a workplace shortage. Our second presenter is Arbella Pluta-Ayers. She's a program manager for children, youth, and families at the National Association of Counties. She's responsible for assisting county officials across the country in their efforts to improve local services related to children, youth, and families. She leads the Counties for Kids initiative, which supports county leaders in investing in children prenatal to 3. We also have Catherine Shibuya. She's the Senior Program Specialist, Early Childhood Success Institute for Youth, Education, and Families at the National League of Cities. Catherine is the key author of Creating Equity for the Early Childhood Workforce report and is a Badger alum. Go UW-Madison. We also have Jamie Albert. She's the Program Manager for Early Childhood Success Institute for Youth, Education, and Families at the National League of Cities, and will be joining us in answering questions you would like to ask regarding the data presented by NLC. With that, I'll hand things over to Barb.
Thank you, Oliver. I'm pleased to be able to share with you about how things are going for kids, how things are going for the kids in the northeast corner of Wisconsin. But also, I know that many of you might not just even be in our area here. You might be in La Crosse, you might be in Milwaukee. And I think what's important for you to realize is that the data might be specific to Outagamie, Calumet, and Winnebago that I'll be talking about, but the story is the same across Wisconsin. Whether you're in Dane County, whether you're up in Richland County or in Milwaukee County, the story is the same. The numbers might look a little bit different, but the way that things have affected, the pandemic has affected children, and the way you can use local resources to support can be the same. It's your story to tell. So I often get asked, how many children are under the age of 5 in our counties? So we are lucky enough to have from the US Census American Community Survey that was done and reported out last fall. You can see the number of children under the age of 5 as reported through the census data. In Calumet County, it's about 5.4% of all the population. In Outagamie County, with over 11,000 children, it's 6.3%. And in Winnebago County, it's about 5.5%. In your own counties, wherever you are, it's probably pretty typical of that. What I find so amazing is the number of children living in single parent households. This is information that you can find in the Wisconsin County Health Rankings. But you can see it's almost 20 to 25% or 30% of children are living in single parent households. That tells a deep story of how we need to respond as a community to support those unpartnered parents trying to raise children under the age of 5. I also brought to you understanding about children born with low birth weight. You might say, why is that important? But we know that this creates developmental issues as we go on. If we don't work to support children early, we can often see these families, these children having developmental delays. Out of the US Census data, we also are able to see the number of children enrolled in nursery schools. Now, really, nursery schools? That's an old term, but that really means preschool. What children are enrolled in preschool? And you can see that this is self-reported numbers through the census data, but it gives you a picture of the number of children that are currently accessing some kind of early childhood education. We also would love to point out the number of children in Head Start. Just in our area, UW Oshkosh had 481 children and their families enrolled. That story is much larger statewide. Wisconsin Head Start Association has almost 15,000 to 16,000 children, low-income children, living at 100% of poverty or less, who are accessing and working within Head Start, who are accessing Head Start services. And last, I think what oftentimes we use as a benchmark is what's the percentage of children at 4th grade reading proficiency? And Department of Children and Families had a Northeast regional snapshot done in 2020, and it showed that only 46% of our children were at that proficiency. So that does tell a demographic story. But what we found, one part of First 5 Fox Valley, is we are the Help Me Grow national affiliate for the state of Wisconsin. And we have a developmental screening expansion project funded by some of the partners who are listening in on this call. And we were able to have an amazing story that we found out. We just kind of wondered, how were kids doing pre-COVID versus COVID in the midst? We were able, with our ASQ, that's a developmental screening tool that's widely used in healthcare and schools and early childhood and childcare programs. And we were able to look at take a number of children looking at pre-COVID, meaning March 20th, 2020 to June 2019 to March 2020, that was pre-COVID. And then we looked at our numbers and what those scores were about development from March 2020 to June 2021. What we found was a 46% increase in the number of children expressing delays in fine motor skills. What does that mean? Kids are not really utilizing those pincer grasps and their fingers. And, if I have some advice to families, we know it builds independence to just have a bunch of Crocs that kids can put their feet in, but really maybe we need to get a pair of shoes with having to tie shoestrings, or a shirt that has buttons, or something that we're working with that children have the opportunity to work those fine motor skills. They did not get that as much during the COVID pandemic as of June 2021. That's a huge piece. Gross motor delays, we saw a 27% increase in children who were monitoring or in the concern category. They weren't moving, They weren't exercising, they weren't running, they weren't jumping and hopping and skipping and doing all of those things during the pandemic. And we see that in the delays that children have. The same thing with communication, and overall, we saw an 18% increase in the number of delays that children were seeing across the board. That alerted us to tell the story of this pandemic is not just about parents and adults and the economic issues that we face as a community, but it also had its effect on children. So another component that we really looked at was the impact of COVID on women in Northeast Wisconsin. We had a collaborative of the women's funds throughout Northeast Wisconsin put together and fund a study of women this was just this spring, March 16th through April 27th. It was done by some professors at St. Norbert's College, and it told a story about the impact of COVID on women. 50% of women ages 18 to 34 reported the lack of childcare had a moderate or significant impact on their employment during the pandemic. Working women really felt the increase of poor mental health and stress because they didn't necessarily have the supports they were having. They were juggling. This report says women were juggling work and home and parenting, and it took a toll on them. Children were exposed to a higher rate of verbal abuse or criticism as reported by the women in the study. Children saw more abuse and more verbal abuse than they probably would have at another time. And that has its effect. It is trauma. It's traumatic for children to see that. Also, we found that in this study, lower income and single women worked fewer hours during the pandemic because they didn't have the supports. They had less flexible work schedules. They were furloughed at a higher rate compared to other women. This study I gave you, as you can see, there's a reference to where you can look it up, but it told a story about women. And mostly childcare industry is predominantly woman-run. So now you can understand the large number of staff not returning to work because of their own daily home needs of families, having to balance their own schedules, dealing with the mental health issues. The hardest hit programs were family childcare. Childcare centers had to reduce classrooms because there was staff shortages. This left a gap in access to services. 74% of the programs had fewer children that were participating in childcare, and that affected the availability of women to go back to work, but also working in childcare. You can see that 42% of the moms had to cut back on their hours or quit a job because of childcare problems. They say that 51% say that cost of childcare impacted their career. And childcare itself is a low-wage industry. Salaries hover just above $10 an hour without benefits. It's hard to fill those classrooms if you don't have staff. And lastly, the cost of childcare is fairly overwhelming. You can see in the 3 counties that Verse 5 represents that the average in Calumet County, the average cost of childcare was $965 or $11,583 annually. That is 15.9% of the median income, and that's for one child. In Winnebago County, it's even higher. The average cost of infant care in a group childcare setting was over $1,000 or $13,900 an annual cost. That's almost 24% of the annual median income. And in Outagamie County, you can also see that we have almost 19.5% of the median income is used to pay for childcare. And in fact, in Outagamie County, 36% of the zip codes are considered childcare deserts. What's a childcare desert? That's when you have 3 children to only 1 spot or less. So it really shares with you the lack of access, the availability and affordability, and the staff felt the need and felt the presence of this pandemic in a more significant way. I'll pass this on to Arabella.
Thank you, Barb. And I think Jamie's going to pop up our slides. Well, thank you all for having me here this morning. It's a pleasure to be talking to you. My name is Arabella Cluda-Ehlers, and I'm the program manager for Children, Youth, and Families at the National Association of Counties Research Foundation. Next slide. I just wanted to start with a little bit of background for those of you who are not familiar with our organization. The National Association of Counties, or NACO, works to strengthen America's 3,069 counties with the goal of creating healthy, safe, and vibrant communities across America. NACO unites county elected officials and county employees to advocate for county priorities and federal policymaking. And the National Association of Counties Research Foundation, or NACORF, serves as the organization's nonprofit, and our mission is to promote exemplary county policies and practices, provide technical assistance to counties, and create spaces for peer exchange. Next slide. So this slide will probably be review for some of you on the call who are working at the county level, but just wanted to provide a quick snapshot of some of the many ways that counties touch the lives of infants and toddlers. Counties play a major role in investing funding in human services, administering federal funding to meet families' basic needs through programs like SNAP, and supporting access to childcare and early learning. In a number of states, counties also play a role in overseeing the child welfare system. And really in states across the country, counties have a key role to play in investing in core policies and services that can align and strengthen prenatal to free systems. Next slide. So today we'll be talking about, I'm going to provide an overview of the guidance for the state and local fiscal relief funds. And I'll be mostly speaking from the viewpoint of counties, but the guidance between counties and cities is very similar. If you have any questions about specifics, I know that both NACO and NLC have some great resources and can answer questions on that. So you'll see the next few slides will focus on what counties are able to do, but the same applies to cities as well. And also just wanted to flag that we have a tool on the NACO website that I'll share a link to that reviews the different funding supports that counties that are eligible for or involved in under the American Rescue Plan Act. But our conversation today is really going to focus on the $65.1 billion that counties received in direct flexible funding via the state and local fiscal recovery funds. Next slide. So I think Barb did a really great job kind of setting the stage of what families have experienced during COVID-19. And the goal of the state and local fiscal recovery funds and the American Rescue Plan Act overall was really to address the public health crisis that arose from COVID-19, but also to recognize that there were implications broader than just public health. So one of the uses for the funds is to address negative economic impacts, and just wanted to call out some specific buckets in here that apply to early childhood. Counties and cities can use their local relief funds to support families with food, housing, cash, and other assistance. They can also provide unemployed workers support and provide job training. So this is important kind of in 2 ways. One, they can help parents who are seeking jobs access childcare, and then also they can make investments in the childcare workforce. And they can also give loans and grants to small businesses to help mitigate financial hardship. So thinking about stabilization type grants for childcare providers, and also assistance to implement COVID-19 prevention or mitigation tactics. Next slide. And then within the guidance, there's within areas that have been disproportionately impacted, which I'll talk about that definition a little bit later. But in those areas, there's an even broader array of services that are allowable. We know that COVID-19 did not impact all communities equally, and this guidance is really to help those areas that were more impacted by the pandemic. And this is where you'll see specific call outs for childcare and early learning. So the funding can be used for new or expanded early learning services, expanded resources for high poverty school districts, new and expanded high quality childcare, home visiting programs, as well as community health workers and public benefits navigators. So thinking about programs like Help Me Grow that help families connect to resources. All of those can be invested in disproportionately impacted areas. Next slide. Oh, one back, thanks. So just wanted to go over some strategies for investing in childcare and prenatal to 3 more broadly with these funds. We have some really great resources on our website if you'd like to learn more about the specifics, or if you have questions about the guidance, and I'll share those. But just wanted to focus on kind of what we're seeing from counties across the country. The first batch of the state and local relief funds for the most part have gone out in the last couple of months. So we're seeing counties starting to make those investments or make those plans. So just to start with childcare, since we know that that was so impacted by COVID-19, there's kind of 2 avenues that counties and cities can provide support to childcare, either by providing grants or other supports to childcare providers, and then also providing childcare assistance in the form of vouchers or scholarships to parents. So just some examples of that. We've seen a few counties as part of their workforce development strategy, really packaging childcare with that and ensuring that some of their local funds are going to childcare providers to expand capacity and provide an on-ramp for parents who are re-entering the workforce. When it comes to providing childcare assistance to parents, a lot of counties are kind of stepping up to fill in the gaps. So looking at areas where maybe parents earn a little bit more than the eligibility from the state and helping to fill that gap, or helping out parents who are not currently employed but looking for work, providing them vouchers for childcare. And then also just wanted to flag that there's some flexibility to leverage premium pay, which can be applied retroactively to childcare workers who are part of the essential workforce, and also some workforce development opportunities. So one exciting model that I have seen in Lewis County, New York, is a partnership with the local childcare development initiative. They're opening a program that will train people to open regulated home-based childcare. So getting folks the supplies and the resources that they need to start up home-based care. And then also just wanted to flag that a number of counties are using these funds to provide incentives like signing bonuses or retention bonuses to just help get folks in classrooms. Next slide. And so these are a few of the strategies that are in those disproportionately impacted communities that I mentioned. Right now, the definition for that is a qualified census tract, which you can see on the screen. I believe that we're still waiting on the final rule from Treasury, which may provide some additional clarity and definitions on what counts as a disproportionately impacted community. But you'll see there that it's communities that have a high concentration of low-income households. So in these counties, this is where funds can be used to connect residents to public benefits and services, provide home visiting services to new parents, and also fund children's mental health services and programs. So a number of counties are investing in kind of these resource connection opportunities. I know that Skagit County in Washington, they've actually turned a local children's museum into a family resource center in partnership with their local Help Me Grow. So that was a great way to reach families at a place where they were already, spending time in the community. In Travis County, Texas, they made a pretty significant investment in home visiting for families with newborns. And I'll also share a blog post that has some more county examples with you all at the end of this presentation. Next slide. And then these are just a few kind of broader opportunities to support young children. Counties and cities are able to give grants to nonprofits that serve young children and families. In Dutchess County, New York, they've created a Learn, Play, Create initiative where they'll be giving grants to nonprofit youth organizations that can be used to enhance program offerings and also make them more accessible for families. Counties can also provide direct assistance to families and households. In Multnomah County, Oregon, they're piloting a basic income program for a cohort of Black mothers with young children. And then we're also seeing a number of counties bringing together experts to inform planning. So creating task forces or committees that includes, childcare providers, parents, folks from your childcare resource and referral agency, just the people in the community who really know the childcare and early learning landscape, bringing those voices together to inform how the funds are spent. And then I won't get into this, but I'll share some resources about replacing public sector revenue loss, which is also an allowable use. And then those funds are quite flexible and can be used for any services that your county would provide normally. Next slide. So I'll put some links in the chat with the resources that I mentioned. And like I said, we have a blog post that includes a lot of the county examples that I just touched on. But happy to answer any questions when we move into the discussion portion. And thank you all for being here.
Great. Thank you, Arabella, and thank you to First Five Fox Valley and Oliver for hosting NLC here today. And good morning to everyone listening in. My name is Catherine Shibuya. I'm the Senior Program Specialist for Early Childhood Success team here at the National League of Cities. The National League of Cities represents the more than 19,000 cities, towns, and villages across our country. We support local leaders through advocacy, research, technical assistance, and much more. Next slide. The Early Childhood Success Team is one of 5 teams that is part of a special entity within NLC called the Institute for Youth Education and Families. This institute has worked with cities for over 20 years. The Early Childhood Success Team's goal is to place young children and families at the center of local policies, practices, and programs so that every community is a place where all young children reach their potential and their families live safe, healthy lives, starting from the very beginning and ending at every stage of development. We do this by providing tools and resources such as policy briefs and action guides, and providing opportunities for connecting with other local leaders through our deep relationships, our peer learning networks, and our communities of practice. Next slide. Before I dive in, I encourage you to visit NLC's COVID Resource Hub, and we'll provide the links at the end of the webinar. In this Resource Hub, you can find the latest pandemic resource protocols, funding options, and more. And while this information contained here is not legal advice, please note that it is subject to change based on updates from the U.S. Department of Treasury. So what does this funding mean? As a result of a year-long Cities Are Essential advocacy campaign, cities, towns, and villages are entitled to a federal grant from the Coronavirus Local Fiscal Recovery Fund. Arabella covered what this funding means for early childhood, but I'll just highlight a few things that are specific for our cities. The funding will go out in 2 tranches and began with 50% going out in May. For metropolitan cities, that includes cities that are relinquished or defer their status as entitlement cities for community development block grants. And for cities under 50,000 that qualify and accept annual CDBG grants, they will receive their second round of funding 12 months after their first. So then the remaining municipalities who are classified as non-entitlement units, they'll receive their funds from their respective states within 30 states of their state receiving their money. So we encourage you to take a look also at our local action tracker, which we'll put the link in later, and that will give you a guide to how much your city is receiving in funds. Next slide. Great, so here at NLC, we've been tracking how cities are allocating ARP funds as it relates to early childhood. And we know that there's not one size that fits all. We've seen different cities taking many different approaches. For example, cities of all sizes can make impacts. For instance, we have Milwaukee, Wisconsin, and I chose that as we're in Wisconsin and we're thinking about the region. $1.2 million will be put to support an early child fellowship program and mentorship programs that are aimed at supporting young men of color in early childhood settings. In Seattle, they've done a great job of recognizing that the importance of the early childhood workforce and the consistently low wages that they're receiving. So Seattle has set aside $3 million for appreciation stipends for the early childhood workforce. Now I recognize that these are larger cities, and we do work with cities of all sizes, and we've put together a webinar, and we'll put the recording in the chat so you can take a look at that. So cities have, next slide. And here are additional slides that you can take a look at. Great. So we know that equity is central to early childhood success. And one thing that we know is that for all children to succeed, equity must be central. These 3 steps can help you embed equity in how you and your city do business. Slide. We also recognize that advancing equity starts early. Investing in prenatal to 3 is critical for the lifelong health and development of that child. What happens during these early years has effects on the short-term and long-term outcomes. Next slide. As local leaders, we can help build the foundation by creating effective programs and policies that provides families and children with supportive relationships and positive experiences through a range of, next slide. Additionally, we know that early investments work. It keeps parents focused and employed at work through decreasing absences by 30%. This means equitably supporting the early childhood workforce, both formal providers at your centers and family childcare homes, but also informal providers such as grandparents and other family members. And we know that investments in high quality early care and education starting at birth provides taxpayers with a return of $7.30 for every dollar that they've invested. Next slide, thank you. So last month, we were excited to release a new resource called Creating Equity for the Early Childhood Workforce. In this, we recognize that cities across the nation are looking at how they can support this workforce. In doing so, there's recognition that the early childhood workforce is complex, and we must support the long-term sustainability of both informal and formal providers. Local leaders are well positioned to think about their needs, the early childhood workforce needs, holistically, including supporting facilities. How can you invest in the early childhood workforce through supporting access to rental or mortgage assistance programs? As we think about the long-term sustainability of the workforce, cities like Seattle are thinking about stabilization grants moving beyond bonuses or pay averages. Cities are thinking about recruitment and retention strategies. How can you use ARPA funds to build a stronger workforce? Consider working across departments to build a workforce program or partner with school districts and institutes of higher education to create career pathways and build a pipeline of qualified program providers. For example, in Austin, Texas, and this coincides with Arabella's point about the county, the Travis County, Texas. Their Success by 6 Coalition put forth recommendations of $19.6 million of ARPA funds to be dedicated to support the early childhood workforce fund sector. These efforts will be funded by the city of Austin, Texas, and the Travis County, Texas, with $1 million being dedicated to stabilizing the early childhood workforce. They're doing this by expanding wage supplements and tuition supports to recruit and retrain qualified early childhood educators. These stipends will be provided for completing their teacher certification. They've also put together tuition supports, which will be available for teachers to continue their education in early childhood. We are seeing new partnerships, not just among city departments and within city and county alignment, but we're also seeing partnerships among community and business stakeholders. Finally, the Creating Equity for the Early Childhood Workforce brief includes strategies and action steps to take as leaders to continue to support the early childhood workforce. Next slide. And this is our team. We have a wonderful team of six individuals working to support the early childhood work community in your community. And next slide. So let NLC be your voice at the national level. We have over 2,500 member cities across the nation working on various issues and lifting up your voices at the national level. Thank you.
Great, thank you so much, guys. I think there was a lot of information presented during those presentations, and we're really grateful for everyone's time and expertise being shared. It's a really important issue. I'm going to start with one of the questions, and before I do, just a reminder to everybody, if you do have questions for our panelists, there should be a Q&A button at the bottom of your screen. Please feel free to send those questions in, and we'll see if we can get them incorporated here as well before our time runs out. But I want to start with a question for Barb, which is that, so can you give us an update locally on what First Five is advocating for using these ARPA funds, and what do we know about these local allocations so far?
Yeah, thank you. So currently, First Five and our early childhood partners are advocating that counties and cities put together, earmark 10% of your ARPA funds to go towards early childhood experiences and programming. That can look different in different areas. We realize that you might live in one area, you work in a different city, maybe you even shop in a different city, that we don't just stay within our one taxable area. And because of that, we'd love to see cities and counties collectively work across borders to do the 10% earmark. And then we could actually look at creating cross-sector, cross-border opportunities that expand developmental screening, raise some support for childcare workforce, maybe creating a substitute pool, possibly looking at adding more home visiting into our program, putting more money into early intervention, into your local childcare programs to support wage supplements. There's a lot of ideas that we have available, and you can find them on the First Five Fox Valley website under an advocacy tab. But how we see, we're really excited. We know that some of the counties have been having listening sessions, looking at implementing and putting some of these ideas into their budgets with their ARPA funds. So we really encourage that there be this cross-sector collaborative work towards earmarking 10% of your ARPA funds for work around young children in early childhood.
Great. So the next question I think is maybe for everybody. It's so great. There's this money, there's a need. That's what we established today. What can an individual do, individual or organization do to help advocate or advance this?
Jamie,
I should come off mute. That would be helpful. Sorry. I'll chime in here. I think having that collective message and voice, those who are in the community actually know the needs. a few weeks ago, NLC did some conversations around conducting needs assessments within your communities. I think that's the best way to work together collaboratively and really show what's needed, and not just have elected officials at any level of government just dictate what needs to happen with these funds. I think it's very important that these voices come together in a collaborative effort, regionally, when you have the cities and the counties working together to filter up a unified message to the state. We've been seeing that a lot, and I just think it has huge impact, and which is part of why we are the work that we've been doing. I think, Arabella, this may have be like the third time we've done a webinar like this, but really driving home the importance of that state and local collaboration. And that's one of the first ways to break down silos, is to ensure that the actual needs and voices of the community are being met and heard.
I'd like to add in too that we are a part of Regional Child Care Alliance for the Northeast area. It's philanthropy and early childhood programs, backbone organizations coming together, and we're doing what we're calling a family survey, a family child care conversation survey. We want to know, what do you really want? What works for you with your family? Not just what you can access, but what would you really want? What does that look like for you? And so you might be asked to answer a survey through your Head Start or your home visiting program, or even if you haven't been asked, connect with me. We'll figure out how to get you started on that. But participating in the family conversation survey about childcare is one way that we can begin to know how to advocate and inform our local cities and communities about what parents want.
Yeah, and I would just also add, I think Jamie and Barb both kind of touched on this, but I think something that's so exciting about these funds is that they're so open and flexible, and it really gives counties and cities the opportunity to figure out what is needed in their community. And I would just say that there's a lot of expertise already. I know like some counties are working with their local childcare resource and referral agencies as a way to connect to childcare data. And also I would encourage folks to visit our Counties for Kids site, which is www.countiesforkids.org. We have some great resources there about connecting with your local county officials, and then also resources for elected officials if you're interested in connecting more with the stakeholders in your community. So I think just having those conversations both ways is so important.
And I think, I'll just add one last point, but I think that it's really great to communicate with partners. Arabella, you pointed to the Child Care Resource and Referral Agency. Are there other partners in there that are really dedicated to families and children, like First Five of Fox Valley? And what is the data that you have? I think coming to elected officials with data and showing that importance. Barb shared some slides at the beginning that I think would be really crucial for, as you're going to tell these stories and show the need for early childhood investments at the local level and even at the county level. How is that impacting your community? You have the data. I think and you have the stories of the families. I think that that'll be really beneficial and impactful for local leaders to hear that and see the impacts.
Great. But before I get to my next question for the panelists, I do want to ask a question of participants. Because I've been wondering this entire webinar, is if participants could put in the chat answers to this question, and they can kind of flow freely, but how do you want to see the ARPA funds invested in our community locally to impact the future of kids and families? I think it's great for us to share in this context, but obviously, as everyone's saying, that we need to then take those ideas and we need to share them with a collective voice. So I want to make sure that everybody has that opportunity to share in the chat just how they could see these ARPA funds. And they're significant funds with a lot of flexibility to make transformational investments to impact the future of kids and families in our communities. With that, I know you, I think Arabella and Catherine both mentioned conversations, and this is along the lines of what we were just talking about, example from Austin, Texas, about a county and a city working together. And I think that locally, as far as I'm hearing, everyone is saying that, but no one is doing that. And so how, do you have any examples or ideas of ways to help bridge those connections between county leaders and city leaders to allocate these funds collaboratively?
Yeah, I think that's a really important question. And I think, like Jamie said, we've been doing webinars like this to help kind of get the word out and get people thinking about where there are those opportunities to collaborate. I think the Austin and Travis County example is a great one. I know also Sheboygan County and the city of Sheboygan have been working together. They have a group of committees that are informing how they're going to spend their funds and making sure that it's crossing across the city and the county. Because I think, like what Barb was saying at the start, is so important. You know, kids aren't just living in one place, you know, and we have these different funds and we need to make them work together for children and families. I also think there's a lot of opportunities for counties and cities to connect with folks at the state level and learn more about how they're spending their state ARPA funds and particularly their childcare funds. I know I was talking to Becker County in Minnesota, which is quite a small county. And something they were doing was really looking at, okay, the state is doing kind of taking the lead on compensation for the workforce. So we're going to provide funds that focus more on facilities and materials and a startup fund for people interested in starting a family childcare program. So I think just thinking about where we can align our efforts so we're not being duplicative or creating more gaps.
Yeah, and I think through my work with the city supporting the Early Childhood Workforce Initiative, we have been doing some work in Rochester, and Rochester has had communication with Monroe County. I think that that's, you know, just kind of figuring out and bringing that data to show the where there are those gaps in services or that opportunity to really support the early childhood workforce. I think, you know, having that information, just reaching out to if there's a county office that happens to work on early childhood, and find departments that are already doing great work on that. I think that that's just a really good opportunity to reach out to the county leaders.
Great. I'll make one last plug for anybody who has questions, attendees of the webinar who have questions, put them in the Q&A for our panelists. With that, I want to just share that if any panelists have any sort of parting words or advice, I'll give you this opportunity before we wrap up here and see if anybody has any final questions.
Well, I would say to realize that the early childhood, to policymakers, decision makers, county executives, anybody who has an opportunity to make this work, it doesn't matter how big or small your city or village is, you're getting ARPA money. You can make it work and make it work for families and children. It doesn't matter how little, how much. It really, if you have a dedicated percentage, like 10% that you want to do something with, the early childhood folks in your community know how to put it to work. Believe me, we know how to make a lot of leverage, a little amount of money to go a long way. We've been doing it a whole long time in childcare. And so we'd be happy to like pull it all together. We want to work with our city and county administrators to make sure we're leveraging it and leveraging it well. We're here to answer those questions. We're here to put it to work. We got a lot of ideas ready to go right now. Just love to be invited to those tables with you.
I'll just chime in really quickly. And Barb, to your point, is leverage your expertise. I think sometimes when we have these conversations, we're preaching to the choir, because if you're in the early childhood field, you've been waving the banner for investment for quite some time. But we're at a pivotal point where preparation is meeting opportunity. So it's just trust the expertise that you have, leverage those partnerships that's been spoken about so much. And there's not a lot of examples no, I don't want to say that. There are examples of cities and counties that have been working together even pre-COVID. I think, and go back to look at how have those things happened, how have those partnerships worked. We talked a lot about Texas, and I think of Austin, and I think of Fort Worth and Tarrant County, who are really doing work pre-COVID collaboratively around early childhood developmental screenings, and how can you partner together to address the kids who fall through the gap, and how do you make sure no family is being missed. And as we look at recovery efforts, think about how we do it equitably, and that goes not just racially, not through the racial equity lens, but also through equity along the early childhood continuum, that we're not pinning kids against kids. So because you're supporting infants and toddlers doesn't mean you can't support preschool and school age children. So how do we really look at continuing those connections, that there's no gap along the continuum? It's a seamless pipeline of supports. And also think outside the box as we talk about where this funding is coming from. Again, leveraging those partnerships. A quick example that came to mind for me when we had the call with Nebraska, Gothenburg, Nebraska, they are literally leveraged, the city is doing work on infrastructure in the sewer pipelines. Well, they had a facility that really needed that work. So being able to tap into that ARPA funding for it frees up funding to do other things for the early childhood lens. So don't be afraid to think outside the box and how you can make the money stretch. And there's time. Stay on top of the ARPA guidance. This money does not have to be spent tomorrow, but just continue to elevate your voice in that unified drumbeat.
And just to piggyback off of Jamie, think about early childhood holistically, think about different supports for families through home visiting programs, and think about supporting the early childhood workforce. How are you increasing compensation where possible, looking at other ways to support financial and their well-being through salary stipends. And then, looking at the purchasing of necessary supplies, we know that this has been an extremely tough year and a half. At the beginning of the pandemic, there were here in our area, there was basic cleaning supplies, Lysol wipes were hard to come by, but it's not just limited to that. What are local leaders doing to support classroom materials and outdoor equipment? And how can you really work to expand the capacity of the early childhood system?
I'd like to just add in, I saw that Roger put in an idea about grandparents who are caregiving for grandchildren. That is happening more and more now. And you're right. We need to realize that caregiving is it is also about supporting the whole family, right? The whole village that takes to raise a child. And that doesn't mean it's young families, young parents. Sometimes they're pretty lucky if you have a grandparent to support them, but we also have a lot of single parents that rely heavily on friends, family, and neighbors to support them in their work.
Yeah, exactly. And I think it's really important that we understand the complexity of the early childhood workforce. It's not just those centers that need that support. It's family childcare homes. It's that family, friend, and neighbor care. And how are we really reaching out to those family, friend, and neighbor care and making sure that they have those supports that they need? I think that's very important. Our grandma and grandpa who are looking after our kids, our families, our friends, our neighbors. How are we as local leaders looking at ways to support them through these ARPA funds? Is there an opportunity to work with the Parks Department or other departments that really put together programs that support not just for licensed facilities, but for those unlicensed providers who have been crucial throughout the past year?
Yeah, and I totally agree with what everyone has said so far. And I think something that I'm seeing is a lot of counties are interested in, well, how can we grow the supply of childcare? We know we don't have enough. And a lot of times people's first thought is, well, we need to build a new center. We need to get a new building. And that's obviously a huge part of it, but especially in rural communities, thinking about those existing home-based providers, whether they're in the formal system or in the friend, family, neighbor category, that's a really great starting point for some of those supply issues. It might be more sustainable for your community in the long run. And then just broadly wanted to say that I think that something that's been really exciting for us here at NACORF is seeing counties really own up to their role in the early childhood space, and seeing that there is a lot that happens at the county level. We know that counties play such a major role in human services, and really just creating those holistic supports for families and children. So I would also just want to offer, and I won't volunteer NLC, but I feel like they would probably say the same. If you have questions, if you want to learn more about what's happening in your county or want to connect with the city or vice versa, please feel free to reach out. I'm happy to share more guidance, more examples, share our resources, or answer any more specific questions about what's happening in your community.
And thank you, Arabella. I just wanted to add another thing. You know, I think in Minneapolis, the city of Minneapolis, they've done a great job with working on family-friendly neighbor care and kind of touching back on that, just to support the early childhood providers and that family-friendly neighbor care. And they've recently got a $3.5 million grant from the state. So I think that that gives you an opportunity. How are you working with the state to support early childhood as well? I think there's so many opportunities for alignment, both within the cities and counties, but also at the state level. So I think that that would be an important avenue to explore as well.
And one last quick point, because I know we're getting close to time. I just want to go back to the beginning when Barb surfaced the data and the number of children within the county. That the data is so important to be able to say, if we have this many children, we have this X amount of centers, however, it's not matching up. Who's keeping all these other children? And that's where you begin to surface those informal providers and just, again, drive home that message. The stories and the actual numbers really help drive home the need around data. So I just wanted to surface that again.
Well, thank you, everybody. I think all those were great parting words, and we got into a whole nother layer of this conversation. And so I think there's a lot more to dig up. And so want to thank everybody for participating today. First 5 Fox Valley will follow up with some information, contact information, and then notes from today to all the participants so that you have that information in the slides. You can also feel free to check out our website, first5foxvalley.org, and you can look under the advocacy tab for information as this moves forward in our local area. I'll put a personal plug. The city of Appleton has responded to the 10% request and is currently in the proposed budget for 2022 as a 10% allocation towards early childhood care and development. And that public hearing happens next Wednesday, November 3rd, for anybody who works in the Appleton area to participate in that public hearing, to continue that advocacy message and the importance of investing in early childhood. Is a great opportunity to do that. But with that, we want to thank everybody for participating today, thanking our panelists, Barb, Arabella, Catherine, and Jamie, and thank you all for being advocates for kids in our shared future. Have a great day.
Thank you.